Good morning, everyone. Thank you for joining us after a hopefully nice holiday or happy Halloween to everyone that happened. Hope you enjoyed it with everyone. Today, we'll be talking about triage and appropriate dispatch of mobile crisis teams, and myself and Jennifer will be presenting today. So we'll just give it a few minutes as everyone's rolling in. We'll go ahead and start with the introductions, but want to be mindful of time. So it's going to be a lot of jam-packed information today, hopefully giving everyone the information they need and give us an opportunity to answer any questions that we have. So thank you all for taking the time and joining us today. Starting off with the California Department of Healthcare Services, the disclaimer. This presentation was prepared for the Medi-Cal Mobile Crisis Training and Technical Assistance Center, the M-TAC project, which is funded by the California Department of Healthcare Services, DHCS, and administered by the Center for Applied Research Solutions, CARS. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permissions from DHCS or the authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from the M-TAC project. And so what we're talking about that new mobile crisis services benefit, which you all have been involved with. And I know I've seen very familiar names here, and hopefully you all submitted that implementation plan yesterday and looking forward to getting it scored and rolling out with that new benefit. I know that was a really big ask for everyone and a big lift. So thank you all for attending all these trainings and all the work you did in collaboration, and still for a lot of you providing that mobile crisis service in real time. So thank you for that. This new benefit is geared to provide mobile crisis services, a rapid response for individual assessment and community-based stabilization for Medi-Cal members who are experiencing a behavioral health crisis. These services are designed to provide relief to members experiencing a behavioral health crisis, including through de-escalation and stabilization techniques, with the goal to reduce the immediate risk of danger and subsequent harm, avoid unnecessary emergency department care, psychiatric inpatient hospitalizations, and law enforcement involvement. Again, this was that new direction for mobile crisis services, and really looking to be very client-centered, resolution-focused, and providing relief to individuals in real time in the community at a location where they're choosing that's in the most least restrictive means necessary for them. As a reminder, the goal of this is for these services to be person-centered, trauma-informed, equity-driven, provide brief intervention, de-escalation, and remain resolution-focused. We want to work from a lens of least restrictive interventions, be culturally responsive, linguistically appropriate, and accessible to everyone that may need that service. Welcome, everyone. I've seen the majority of you have already jumped in and put your names and titles in the chat. I appreciate everyone doing so. If you have not, if you could please just put your name, the county you're from, what department you're from, please in the chat so we can welcome everyone. With us, it is myself and Jennifer Hodgson. She's a licensed marriage and family therapist. She's also a PhD. She works, and she's been a consultant throughout this project. It's been a pleasure working with Jennifer throughout this time. She works in this with this M-TAC project directly, and she's from the Health Management Associates. My name is David Lopez. I'm a technical assistant specialist with the Center for Applied Research Solutions, and we'll be presenting this information for you all today. And now I'm turning it over to Jennifer.
Sounds great. Well, I almost said we should have them put in there what is the funnest thing that happened yesterday with their if they celebrated Halloween. So there was a lot of really fun things last night. So hopefully you had a good one. Our agenda for today is to go over the BIN 2325, just in regards to dispatch requirements. So we're all on the same page with what we need to be implementing regarding dispatch. That will be our focus for today. So we'll give a general overview of that. what the role is, what technology assisted dispatch is, what a well coordinated dispatch looks like, safety protocols, not ever forgetting that the engagement of the people who are calling and creating a warm and compassionate environment for them is always the goal. And then we're going to go through the dispatch tool that DHCS has created, as well as the companion guide that goes with it. What we did is we merged them into this PowerPoint slide deck, but they will be getting disseminated for counties to either implement or amend for their own purposes. So we're just going to go through what it looks like in the form that we're able to show you today. And then, David, when will they be having access to those tools?
Those tools should actually start going out this afternoon, either this morning or this afternoon. So
Okay.
they will go out, and the constant contact, the email notifications will be going out. All tools have been finalized and approved, and they should be out to everyone already and in the
Yeah.
universe. And
Yep.
so that was a really big lift. I know a lot of
Yep.
counties were asking for it to get their eyes on it. So it's out there.
Yep.
So
Thank you, Stephanie. Stephanie confirmed that they got the email this morning. So those were definitely labors of love. But we'll go through some of the main content areas today in this presentation. And then any further questions you have, you can always ask. The learning objectives, we kind of hinted at those in the agenda, but we're going to go through dispatch requirements, critical decision points for counties to consider as you kind of develop and enhance that infrastructure, particularly as it relates to dispatch. We'll talk about safety resource considerations, and then the dispatch tool that we've created. And please know that this particular training is built on the shoulders of other trainings that you have already either had access to or can always have access to for reviewing, growing your knowledge, applying it. So re-reviewing, but this list of previous trainings are ones that David and I thought really were helpful building blocks for what we presented today. And then there's one coming up, the crisis assessment part 2, on November 7th, that David will be a part of as well. And that will also kind of help build some of those foundational components for dispatch. I'm going to turn this over to David to talk about the bin.
yeah, thank you. And again, I know that the majority of you, well, there's a whole lot of required trainings that everyone has attended, and I've seen so many familiar faces throughout this project. So the crisis assessment part 1 was really just helping to lay that foundation. The part 2 will actually be working through and looking at those distinctions of what it is to actually assess someone in crisis as opposed to how to talk to someone in crisis. And that was one of those back and forths that we had. So anyways, so going ahead and going over what the bin requirements are for all of us. And it is, so the bin that you all are so familiar with, 23-025, dispatch requirements. The Medi-Cal Behavioral Health Delivery System, it establishes that we still have a system in place for dispatching mobile crisis teams and develop policies and procedures that shall include, but are not limited to. So the things we must have is an identification of a single phone number to serve individuals in crisis services hotline connected to the dispatch of the mobile crisis teams and triaging those calls, to have and utilize a standardized dispatch tool and procedures to determine when to dispatch a mobile crisis team, and procedures to identify how mobile crisis teams will respond to dispatch requests. So I'm sure this is all things that you've written down in your plan and you've thought of extensively or have been doing. So the bin just outlines that front-facing number needs to be there, accessible for everyone throughout the county, that there's knowledge, and then that you're going to use the standardized dispatch protocol tool, whether it be your own or the one you adopt from DHCS, to help screen those individuals in crisis. So some of those dispatch requirements, the Medi-Cal Health Delivery System shall identify, again, that single telephone number that individuals can call. The number can be the same as the county's 24/7 access line or an existing crisis line. If the Medi-Cal Behavioral Health Delivery System ensures that the line has the capacity to respond to members in a crisis and to dispatch those mobile crisis teams when appropriate. Additionally, the Medi-Cal Behavioral Delivery System shall coordinate with the 988 Suicide and Crisis Lifeline, local law enforcement 911 systems, if with for FERS or the Family Urgent Response System, and community partners to ensure that members have information about these mobile crisis services. So how are we going to create that awareness? That was that outreach and awareness piece that was requested in the implementation plans. And then we want to have, they want a strategy to have a system in place to document where the strategies for establishing the crisis lifeline, the hotline for use of the members in crisis, and those outreach plans that I just mentioned right now. And now going into, so what's the role of dispatch? Like, how does this come in? What is the dispatch team supposed to do? How are these access? How is these crisis lines supposed to operate? Well, the first part, the role of dispatch. Dispatchers, crisis line workers, whatever your team is comprised of, potentially could be the mobile crisis team members itself that are staffing that crisis line. They're the first to evaluate and gather a sense of the crisis at hand. So they're going to be the ones that are answering the phone, that are making whatever county greeting you may have, acknowledging that this is the crisis line and that you're here to help that individual, and then taking in that initial sense of what's happening in that individual's life, whether it be the person themselves that are in crisis, or it be a family, friend, loved one, concerned individual about someone in crisis. So that's the first part of the role. You're going to start to evaluate the safety up front. We want to make sure that there's a safety concerns addressed, that the individual in crisis does not need some medical attention. We're going to go on that a little bit further, and that that the person in crisis actually fits the ability or the capacity for the mobile crisis team to respond safely to that environment. So you want to make sure all parties are safe. Once that's addressed, we will send the mobile crisis team to wherever the need is in the community, with the exception of restricted settings. So an example of an restricted setting would be like your crisis stabilization center, or like an emergency room where you wouldn't go into that center to provide the de-escalation, as those agencies and locations should already have crisis services involved. And then mobile crisis dispatch will identify available mobile crisis teams and provide them with all necessary information gathered during that initial call, and send the mobile crisis teams to the person in crisis within their service area. And this could be a home, workplace, or other community-based location, park, school, something of that nature, where the individual is in crisis. And we want to do that in a timely manner. There's 2 time sets that you all should be aware of. It's that 60-minute within city and 120 minutes within the rural areas. So that's the timeline that you'd want to adhere to majority of the time, understanding that there'll be a range, but those are the 2 time frames. And now I'm turning it over to Jennifer.
Yeah, so technology assisted dispatch. And I did put in the chat, Dave and I are really passionate about your input and involvement. So we know that some of you have extensive training in dispatch, mobile crisis dispatch. We would love to hear ideas from you and your experience. So feel free to put things in the chat as they come up for you, things that you think would be helpful to others. We just learn better together. So we just wanted to make sure that we included that little point in this training, that you're as important in delivering this as David and I are in this opportunity today. All right, so technology. This was sort of a fun one to put together, because what Dave and I did is we looked at nationally what was happening. So outside of the state of California, there are about 10 states that have mobile crisis services dashboards, where they can visually track and analyze key performance data. So as you identify the metrics, and as DHCS figures the metrics through on what they want for reporting, you can view in real time how you're doing, where there may be areas where you can use more resources and supports, where you're really gaining ground. And you can reflect that back to your teams and have celebrations together, or where additional training might be needed. So these real-time dashboards help us to look at impact, look at service needs, look at training opportunities, where we can continually to improve what we're delivering to the people in our counties. There are 4 states, DC, Georgia, Ohio, and Texas, that have dashboards that integrate all of their crisis services together. So 988 Suicide Crisis Lifeline, Mobile Crisis Services, and then crisis receiving and stabilization facilities. So they can see that all in real time, what's happening across those. And then we have, to our knowledge right now, 4 states that really have these dashboards where, and they're available to the public: Arizona, Iowa, Maine, and Ohio. So if you wanted to, those are hyperlinked. So when you get the PowerPoint, you can look in those and see how other states have set theirs up so that you can decide, what you want to do, what you want forward facing, what do you need to be able to reflect internally to your teams. So we just wanted you to have some opportunities to look at what these dashboards can do, to help create efficiencies. And I'm a big fan of templates. I like to see what others are doing that are working. If it ain't broke, don't fix it. So that's why we wanted to at least have some good examples for you on things that you can model yours after. There are a lot of high tech tools that are available that other teams are using across the country, like GPS enabled tablets or smartphones. They're actually using that so that they can determine, okay, which crisis team is closest to where the call's coming in. And if it happens to be in another county, sometimes they're able to sort of reach out to the other county and see if that crisis team can get there quicker. So they've even been working across counties using that sort of GPS technology to really help create efficiencies. And as David was saying, with the time frames, reduce those time frames down so that we can get to people quicker. And then again, these performance outcome dashboards. So using technology to be able to show us how effective we are, to be able to, we have technology where we can help boost cell phone signals. There's a lot of really cool gadgets that we can use to create efficiencies. So, all my experts that are in the training today, what are some other high tech tools that you've heard of or that you've used that can help our mobile dispatch and teams in their work? So, not only help the dispatchers, but help the teams in their work. What are some high tech tools that you've all become familiar with? I know we've talked about some in previous trainings, like the booster for the cell phone signals. What was the other one? Oh, it was having like a remote Wi-Fi access that can come with you so that you don't, for some of our more remote areas, they're able to carry that with them. So it kind of boosts their Wi-Fi signal. So if you
Smartphones, satellite phones has been another one
satellite phone, that's
for
another one.
for rural areas or hard service areas.
That's it.
That's and then
Absolutely.
potentially even having radios that are patched in with your local PSAPs or emergency service locations. So that's just additional service supports that you can have.
Absolutely. And you made me think of something too, David, when you were saying that is, sometimes it's just a matter of talking to our other local emergency services and finding out what they're using because they're having to go out into some of these remote locations as well. And so, what are they finding helpful to carry with them? Beacon Dispatch allows SMS alerting for low connectivity bandwidth settings. Excellent. Thank you, Jason. So that's part of the stakeholder meetings. Could also be given the terrain. I've only heard of a Chorus app tool. Okay, Ruby, I haven't heard of that one. We'll have to look into that one too. Um, QR codes for resources. That is a good strategy. Absolutely. So that people can have easier access to materials. And then as we get even better at translating materials, so we might have QR codes that are for specific languages. So I think that's an extremely good resource. So you're right, share all of these things, but the stakeholder meetings can be a place where you can also exchange those resources with your EMS paramedics, law enforcement, what are people using that are going out in these crisis calls that they have found extremely helpful for both access and safety? Because we're thinking both and in these situations. All right.
Yeah, absolutely. And that's to Jennifer's point right there. That's connecting with your local services, as they may have a beat on what that technology is and best advise you or guide you. They've been doing it for a long time. Checking in with the Office of Emergency Services at we're in California, so Cal OES. What do they
Good.
have? Is there any tips or tricks that they know for everyone? So um, moving
Excellent
on. Thank
job.
you, Jennifer.
Absolutely. All right. There you go. Oops. I think you go for it. I'm going to.
I know we're touching the thing. All right, so I don't know if I'm one ahead or two ahead. Let's just see here. Yeah, results of a well coordinated dispatch. So here's we pulled some research from across some studies that have been done around the country. We picked out two that seem to have some pretty good. One was a study in Arizona that was done in 2019, and it was found out after a mobile crisis encounter. So what were the results after this mobile crisis encounter in the field? 71% of calls will resolve without the need for transportation to a higher level of care. So mobile crisis is very effective in this study, or it shows to be effective. 68% of callers did not have a subsequent emergency department visit or hospitalization within that 45-day stay or that 45-day period. And that could be a combination from the interaction itself to follow up with that individual in crisis, to ensuring that maybe they were linked or get provided a warm handoff to another service provider, or just that initial crisis encounter itself, where you were able just to join with that person, meet them, meet their needs, help them de-escalate process, get in a better space, emotionally regulate, and then be able to return to their host environment or remain in their host environment without needing a higher level of care. On a national level, a study for about 48 states found that 16% of 988 crisis line calls resulted in the mobile crisis team being dispatched. So, with that being said, of those that were served from the 988 mobile who identified as a mobile crisis team was necessary, 49% were resolved successfully without the need for no further immediate care. 13% did require further crisis stabilization when it was available. That was 13%. 14% required an emergency room visit, and 39% needed some follow-up for inpatient or behavioral health visit. So when you're looking at this information and how it applies to you, it's mobile crisis services are effective. And it starts with that point of dispatch. So you're receiving that call. How are you relaying it? How are you allowing the time to help that individual, giving them that space, giving them that individual attention? And everything that you do starts with this dispatch to get the team safely to a location that is going to be beneficial to help that individual in crisis. So now, as I touched on safety, we're going to talk about some safety protocols for dispatch, because we want to make sure that both everyone in the mobile crisis team feels safe, and that the individual in crisis doesn't need a higher level, doesn't need some immediate medical attention, or there's a risk that we need to know about up front. And just a selfish plug or a shameless plug for tomorrow's office hours. We have two counties that will be coming in and speaking further to safety protocols that they'll be doing. That'll be tomorrow, Thursday. So circling it back here. So the safety protocols for dispatch. Some of the things that you want to consider up front, right? You want to ensure that call for service, whatever that crisis call came in, that call for service is for a mental health or substance use crisis, which requires a mobile crisis response, right? One thing to note is that this, as crisis lines or as lines become advertised, it could be a point, and we want to have a wrong door approach. We want to make sure that call for service is appropriate for a mobile crisis team, and that it's not more appropriate for another type of service. For example, one of the last things we listed here is that for an individual that maybe be seeking shelter, food, clothing, someone who's experiencing homelessness, who's looking for some different types of social services. that may be met, or that need may be met if there's not a crisis, better met by a social services or someone that can assist with housing or a PATH program. Um, so ensuring the call for service is actually required to is in need of the mobile crisis benefit. We want to confirm that there's no injuries up front and that the person in crisis does not need medical attention. That's one thing that we want to get really clear on to make sure that no one's injured at the scene. Confirming that the person in crisis is not in possession or does not have immediate access to weapons with them, and that that individual in crisis is not making threats of harm or violence to self or others. And another thing to think is, or another question to ask, and we bring it up in the tool, is to make sure that that person in crisis that's not making threats to others for harm or violence, or that they would harm or harm someone that's willing to intervene or attempting to intervene and help them. We want to confirm that that call for crisis is not for a welfare check, and ask if that law enforcement is not specifically requested. And all of those considerations are actually built into the dispatch tool itself and the companion guide to help give you some additional questions or methods of how to elicit some of those thoughts from the individuals in crisis. The next thing we want to do is talk about creating a space, a sense of warmth and compassion when you're having through that critical dispatch process. As I had mentioned at the top or a while back, that person who's answering the phone, your mobile crisis team dispatchers, they're the first voice they hear when someone's in crisis. And it's very important that they're empathetic, they're caring, that they sound that way, and they really voice a place of concern for that individual. And it all starts with connecting with the individual in crisis. Now, while dispatch is a little bit different, as we want to triage that call quickly and in a timely manner, we also want to slow it. Like once we're checking off that, ensuring that there's no immediate risk for that individual's medical health, or there's no immediate risk to harm to someone else or themselves, like how you can slow it down a bit, just a bit, to gather that information and really connect with that caller. Because connecting with that caller helps to establish that you can slow things down, that helps in the way, that they called the right place, that their needs can potentially be met. And it starts off by acknowledging that individuals who are calling this line can be in a multitude of different emotional states. They could be as the individual themselves reaching out for crisis, or it could be a family member, a loved one, a concerned parent, a concerned teacher, just a concerned citizen in the community that's worried about someone and not knowing what to do with the behavioral health crisis or what they're interpreting as a crisis. So as soon as you pick up the phone, or as soon as that call is answered, we want to assume that the caller is in some sort of crisis, whether it be their own or someone they potentially care about or is in the community. With that, you want to come with you want to align with that caller. You want to join the caller with a warm and reassuring voice, and in a tone that the caller can hear and speak easily to. So having that neutral tone. We don't want to have that extremely positive customer service voice that you get, like, thank you for calling Verizon, nothing like that, right? We want to just be warm, calm, and assuring. They want to know that you're greeting the caller with a tone and letting them know that they called the right place. So acknowledging that this is the county's crisis line and they're here to help them. If the caller is extremely upset, it's regulated, we want to reassure that, we're here to help. We want to help them slow things down so they can gather themselves. We want to help them regulate. And in times you may ask them to take a few breaths with you. Can you take a deep breath? Can we slow it down? Let me gather a sense for it. And then using phrases like, I hear that you're upset. Help me understand what's going on. Help me gather a sense of what's happening so we can get the most appropriate response for you. And then part of that triaging is helping de-escalate from the point of crisis, right? Like, how are we determining that this individual is able to wait for a mobile crisis team to arrive? As the times can be up to an hour, maybe up to 2, and ensuring that it's okay, like they can actually wait for it. So from that point of contact, getting the information up front, joining with the caller, and gathering the sense of the story from them. This is when we're getting those details, right? So, gathering details. They could come out and say a whole lot of things really quickly, and it could come out in a very pressured approach, like, "Oh my God, this is coming!" Da 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 da. Again, having them slow down, take a breath, so they can articulate or they can explain to the best of their abilities what's going on in their life, and the dispatch team can get a sense for it. So as they're exploring, they're opening up, they want to get the details. Can you tell me a bit more about what's going on? Can you help me understand, when did this occur? Where is this occurring? And you want to sometimes, with family members calling in for individuals, and I'm sure, and this may be experienced for those that have been doing it for a while. They want to minimize. Family members tend to minimize what's actually happening with their family member to protect them, and you want to elicit that type of information from them. And it's natural. Family members may say, "Oh no, they're not saying this, but they know they need some help." Well, can you tell me a bit more about what's happening so I can better understand the situation? And then also just know that that's part of the art of crisis assessment, the art of dispatch, is being able to be supportive and engaging with them while eliciting that information. You want to be supportive, engage in active listening during the call, ask clear questions, and expand upon them if they're not clearly understood. As you're working your way through the dispatch tool, and as Jennifer goes through it, which is you'll see that we want to make sure that we're getting some clear yes nos or an understanding that everyone's on the same page to make that determination of what's the most appropriate response. Again, to ensure the safety of the individual in crisis and your mobile crisis team. So we want to make sure that that scene is safe. And as you're gathering that information, paraphrase what that caller is saying. Repeat it back to them. Did I hear this correctly? Is this what I'm hearing? And just want to ensure that everyone's on the same page, that you got a clear understanding of what's being said by the person in crisis, that you know what the scene will look like, what's going on, how you can get there, and what's happening situationally, or what's been happening, at least gathering a sense of what transpired in that person's life and what led up to that crisis event, right? Like what's going on and what's the immediate need.
So if you did get the email and you were able to open it and look at some of the tools today, that's great. If not, this will just be a nice little introduction for the dispatch tool and what it is that we're asking counties to include in it so that your dispatchers are well prepared. So again, these are just some recommendations. We have the tool, we have the companion guide. The most important thing, and as David has said, is about safety. We want to safely screen in individuals who would benefit from the service. So we've really tried to change the language from screen out to screen in, because the mobile crisis benefit is about really getting to as many people as possible to reduce law enforcement, hospitalization use, and to get meaningful services to people when they're most vulnerable, need it the most, and then getting them into other resources, whether it is basic needs types resources, behavioral health resources. So we want to screen people in so we can get those needed services to them as quickly as possible and reduce barriers between. We and David covered it beautifully in the beginning about the intention to be culturally responsive, person-centered, trauma-informed. I know you've gotten that throughout all the trainings. But the big thing today is we do not see this tool as replacing clinical judgment. It's just an augmentation and a resource for you as your dispatchers gain more and more proficiency and skill and experience. There's just an intuition that comes with this job that will really help them guide, because you may have somebody who is answering the questions and something's not sitting right with you as a dispatcher, and we encourage you to follow that. If there's something that's telling you this might be more severe than what this person's leaning into, we encourage you to provide that information to the teams on warm transfer. So to never assume that, just because a box wasn't checked, that your intuition isn't checking it. Um, So, important on each of your dispatch tools, we obviously want to log the start and the end times. Why is that important? Because it's good for several reasons. It helps us to look to see what are the types of calls that we might need to have additional supports for training around. Are there certain opportunities that we have to maybe ask questions a little differently, give feedback to some of our dispatchers to help strengthen the way that they are fielding calls? It could be, we're needing to work on things around language access. So there could be lots of reasonings why time is taking longer. And that's really important that we're able to note that. We also want to make sure, we're delivering different sections of the tool, delivering a good greeting to the caller. And David handled that very beautifully, that warm tone of voice. You can come up with your own greeting. We have provided one for you in the tool, but certainly you may come up with something that works better for your teams. We don't really have as much time today to talk about some of the additional ways to build rapport on the dispatch calls, but please, please put this in the chat if you've got other things that you have found are particularly helpful. Like if you live in a county where they have speak a large population are Latino, or a large population are people who are looking for different resources, like from the reservation, and they need different engagement. You may have different ways of initiating that greeting that would make a real difference for people feeling seen and heard. We want to collect vital contact and location information. Now, we say to do this right away. And why is that? Because sometimes something happens and the call gets dropped, either on the side of the caller, or maybe there could be some sort of event that happens, natural disaster, or something else that happens, and the call gets dropped. So at least we have the caller's name and the phone number that we can get back to them with. Sometimes it's a really bad connection for some reason, so we can at least be using another line to call them back on if for some reason that line's not working. We want to get the name and the age of the person in crisis. So knowing that the caller may not be the person in crisis, they may be calling on their behalf, or they're witnessing somebody having an event and they want to get some support to them. So we want to at least get the name and the age approximate of that individual, and then what the relationship is of the caller. Are they a friend? Are they just a caring citizen? Is it a teacher? Is it a spouse or partner? That's going to be really important. So when the team goes out, if that individual is there, they're going to have a sense of, okay, this is the one who called things in, and the engagement might look a little different. Location of services is really important as well. Now, some of the forms, you may have check boxes for some of the more common spaces that your teams might be dispatched to. That may look different in different counties. But location of services could be a residence, it could be a shelter, it could be a school, it could be. I had one of our individuals who co presented with me talked about how she would go to an intersection sometimes between streets, and that's where that individual was. So we want to get a really rich description of landmarks, street names, even like the height or the color of the building, if that would make a difference, to the store name, so that we can get people to them as quickly as possible. And that's if no address is available. And if there is an address available, might still be good to get some descriptors in the event that GPS sometimes isn't always as reliable as we like it to be. So we can say, okay, this isn't looking like what the person described. Let's double check our location. We want to make sure the first thing is to screen again for urgent medical issues. If this person is bleeding profusely, as a significant physical injury, then clearly we want, as David will oftentimes say, as he's talking to the individual, he's also contacting 911 at the same time. So we keep the individual on the line, but we're initiating 911 so we can get that EMS service to them as quickly as possible. So those screening questions on the tool are going to be really important early on. So as we're continuing to collect information, we have this other thing going at the same time. If the call is from a third party and it's an urgent medical issue, Some of the things we want to ask: is the person unconscious? Are they at high risk or in an active opioid overdose situation? If that's the case, then our instructions would be to see if naloxone is on hand. And if it hasn't already been administered, have that individual administer it if it is available. At the same time, obviously, getting 911 there as soon as possible, because there's only that window of opportunity where that drug is going to be helpful. And we want to get our emergency services there to work with that individual. If not, if it's not, A or B in this, then we also want to ask if there's weapons somehow involved. So is the reason the person's bleeding because there was a lethal weapon, there was a gun, there was a knife, um, so that we can communicate this information to dispatch so they know whether or not they need to send law enforcement and EMS. So they have, what the tools they need to respond safely to what's happening for that person in crisis. Okay, the next part of this is we want to assess for self harm. So, if the individual is threatening self harm, do they have a method in mind that they want to use to hurt themselves? Do they have the intention to act on those threats to hurt themselves? And then asking, do they have lethal means accessible to them, firearm, prescribed, or other drugs that they're intending to use? So people who call and ask for help, sometimes they don't have, these things outlined. We still take it very seriously, but it helps us to be able to dispatch safely if we know we're dealing with somebody who has a firearm on hand, or somebody who has the means to be able to hurt themselves. That really, in that moment, is really important. And then, does the person have the intent to harm anyone who attempts to intervene? So you may have a third party caller calling, but they're concerned that this person said, if anybody comes to the house, I'm gonna use this, weapon. I'm gonna discharge it. That elevates the level of safety as well, so that we're going to be able to communicate that information in a warm transfer with law enforcement. And then at the county levels, you all will decide what your response will be based on the resources you have. So if you have a co-response model you can access where you go out together, or maybe it'll be a sequential model where you're going to have law enforcement go first, and then your mobile crisis team will either be on standby, um, on site, out of sight. It could be the opposite, depending on the level of risk. It could be your mobile crisis team goes first with law enforcement on site or out of sight, but close by. So, as a county is deciding how you want to respond to each of these, based on level of risk as it is elevated. The other we want to assess for is harm to others. So, again, same sort of types of questions that we ask with harm to self. We want to know who the attended person is, which is a little different, or persons. So, is it somebody who is inaccessible to them, inner circle? Could this be part of some sort of altered mental health, where they're, thinking about somebody who may be a high profile figure, celebrity, politician? We still want to make sure we're noting this down. We take all seriously, but this is going to be very helpful for us in determining what we need to dispatch along with the mobile crisis team. And is it safe to dispatch the mobile crisis team, or do we need to warm transfer this to another dispatch service so that we can get the right and appropriate amount of support to that individual and keep everybody safe? So you're hearing that theme of safety come through. Then the screening if they happen to be under the influence of substances or alcohol, that's also important. Sometimes we may, get callers who they're not sure. I can't tell. I don't really know this person, or they've used in the past. I don't know if that's changed recently. But if they do know, that can be very helpful for us to not only know if we need to, bring 911 into this, or if we just want to be mindful when we get there, if their status is changing, from what it was when the caller called to the time it took to go out. Could it be that somebody is having some sort of overdose impact of whatever it is that they've taken? So these are all really important pieces for our teams to know before they go out. And they might have symptoms. So the person may say, I don't know, but they're shaking. I can't make sense of what they're saying. So these are things your dispatcher would need to know. Okay, that could be related to overdose, but the caller may not necessarily know that. They're just reporting to you what they see. Um, Definitely, we want to record the reason for the call. You're going to see on the tool it's a little bit lower than at the top, and that's because we want to get those main safety issues, contact information, things decided first and collected, and then we may or may not need to ask a prompt for why they're calling. We may have already gotten that information from what we've asked already. But if not, in the words of the caller, as much as we can, we want to capture the exact reasoning for the call, so that when our teams go out, they can reference that. So, they can reference that they were, coming to support somebody who's recently had a significant loss and who seems to be, having a really bad panic attack and cannot communicate. And so, if our team knows that going out, then they can be prepared to intervene with that level. And it might be, because people are like onions, we have many layers. It might be when they get out there, there's other things that come out, but it also helps people to know they were heard if we go out there and we repeat what they've shared with dispatch. Okay, we want to screen for location safety. So it could be that through the call, we get a sense that we need to make sure the circumstances are safe in which our team is being dispatched into. It's good to ask about animals on site. Sometimes animals can be very protective of their owners, especially if their owners are having a difficult time. So when we go out, we want to be aware of that no matter how big or small the pet is. Sometimes the little ones can be even more ferocious. So you might want to take some little doggy treats with you. It could be they have other types of pets in the house, and we just want to make sure that our team is safe as well as the individuals who are also there. If there's any weapons that have been in active use in the area, that may have initiated the person's crisis response, maybe from previous trauma. So it would be good to know if they said, I heard guns fired in the area and I'm panicking and I'm scared and I don't know what to do. And so that's something we want to know because of dispatching our team into that same environment. If there's a contagious health issue, if that we kind of get some sense that this individual has had exposure to something, we want to make sure our team is safe. It may just be putting on a mask. It might be something else. If they, have problems within the home, like if it's a smell of gas, we may want to obviously create other types of resources to make sure the scene is safe. And then if an abusive partner on site, if your person's whispering, if they're scared, then anybody comes to the house, this person might get mad at them. That's another piece of information. So if you notice somebody's whispering, you might want to ask about the reasons why. These are just some examples of prompts. And in the companion guide, there are lots of prompts in there. If you're training somebody and they're not sure how to ask about things, we've tried to put some prompts in there to kind of help those individuals know what that could look like and sound like in asking these questions about location safety. We also want to ask about accessibility needs. So, if the individual speaks a language other than English, they have a preferred language so that we know if we need to enact apps or other resources, bring our interpreters if you have access to them at the county level. These are things we want to know. If they're visual or hearing impaired, do we need to bring a sound amplifier? Is there, we want to bring resources for them to read? Do we need to have them accessible in Braille or other things that could help that individual process the difficult time they're having and have the resources that they need in addition to that? So it's really important we know if we know we're going to need an ASL interpreter, that's another resource that we want to be prepared to have when we go out there. Now, our team might go out and discover it there, but the earlier we know about it, the more we can prep and have these things ready. And again, just some prompts that we can ask in order to be able to know if we need those services. We're going to collect information on the support persons that or others that might be present. Will that person remain on site or are they leaving? That's an important question to know about so that we know if it's a child, is that person going to be left alone? Or if that person leaves, is the person in crisis going to be left alone with children? So it helps us to be able to figure out safety, resources, response times, and then who we need to ask for or expect as much as we can when we get to the scene. And then you want a section on your tool that says what your dispatch decision was. So, did we decide to do joint, co-response with law enforcement? Did we decide to do a sequential response? Who is the name of our team members that went out? So, David and Jennifer went. We want to put their names on the form so we know um, who we dispatched if somebody should ask later. If we're not dispatching, we want to include the reason for why. If it was somebody needed more a 911 response because of some significant injuries, then that would be the reason why we may not go. They might refuse services. So we might refer to 988 because they were willing to talk to people on the phone but didn't want us to come out. If they had language or accessibility needs, we want to note that. If they have sensory issues, if they might need an intellectual disability consultant on site to be able to help, we want to be able to know that as well. And then again, any visual impairment, hearing impairment resources. We also want to know if the dispatcher needed to consult with a supervisor and who that person was so that we can look to see how much access we might need and support resources we might need for the complexity of calls. So, is an end to the bin is really requiring that we implement the mobile crisis dispatch screening tool. That's got to be a part of our implementation plan. Some of you have developed your own. Some of you may choose to adopt the DHCS version. We encourage you to do what works best for you, knowing that you can modify the tool to fit the needs that you have. Safety is always the most important driver of our dispatch decisions. So, really, the way you organize your tool, you want to organize it to get those safety pieces as quickly as you can. We want to make sure our teams are aware if there's lethal weapons or threats to harm of self or others. Those are critical screening steps. We want to make sure that comes out in our conversations. Our implementation protocols need to be written to make sure safety is a priority, especially when our teams have limited information. The counties, again, having these stakeholder meetings can help you with technology questions, can help you with response questions. If do we have a co-response with law enforcement model? Do we have a joint? Do we not have those kinds of resources? So we're going to have to think about either building them or how do we manage with what we have at this point. And then how is what we're doing person-centered, trauma-informed, and culturally responsive? So we have just a few minutes left. I know that was a lot of information. If there are any questions, feel free to put that in the chat. Um, David, I'm going to turn this over to you to just finish us up.
So the survey has been dropped in the chat for today's presentation. Thank you all for hanging in there with us, for all the work and all the trainings that you've attended, for everything that you're doing, and showing up every day to help those individuals in crisis. The work you do matters, and don't forget that. So please, if you do have any questions, we're hanging around here for a few minutes, and then just allowing that time to go. That's the survey I just mentioned. If you please would take some time to complete that, we would appreciate it. There is a question from Claudia. What were those locations you said that we would not respond to? There's a few of them. So the locations, Claudia, if you are speaking to at the top of the presentations, there's certain areas that, like for a hospital, for instance, wouldn't be a place because that's already a space where the individuals or that location, that service should have crisis units embedded in it, and that's where you cannot respond to that benefit, or you cannot respond to and bill that Medi-Cal Mobile Crisis benefit. It's disallowed. And then there's a whole list that's in there, and it's actually hyperlinked in the presentation. Is that what you were asking for, Claudia? Just want to make sure because there's a few of them. Yes. Okay.
And there's quite a bit about Spanish, like having not only the resources in Spanish, but the presentations in Spanish, and just kind of help immerse people in the language. I think that's really great feedback that will make sure we get to DHCS. So thank you for bringing those things up.
Yeah, I know in conversations with DHCS, they did mention that they were looking at translating the tools into a few threshold languages. Obviously, I believe California has 14 or 15, so not
Mhm.
all of them. But that is something that we'll take back to DHCS for sure, so we know.
Right. We have an upcoming presentation too that's going to talk about languages in our state of California. So there is a lot. So it's you have a lot on your plates when you're developing these things, and we're here to definitely support you with that. So, all right. All right, everybody. Have a great rest of your day. You've gotten what you've needed, and please let us know if you haven't. We appreciate you.